This presentation is about nurses and midwives and how health policy makers and planners worldwide can fully maximize their contributions to health services and outcomes. Nurses and midwives make up the largest component of most health workforces around the world. They work across a wide array of essential health services. When strategically used, the skills and abilities of nurses and midwives can have a huge positive impact. However, in many contexts, the contributions of nurses and midwives are not optimized to meet the health needs of the communities or to achieve national health goals. How do we know this? In 2020 and 2021, WHO worked closely with member states and partner organizations to assemble 2 reports with the best data the world has ever had on nurses and midwives. The 2 reports found major challenges in 4 key areas: education, jobs, leadership, and service delivery. In some countries, the quality of education for nurses and midwives is not high enough. Those who complete their training do not have the skills they need for the workplace. Sometimes, the faculty responsible for teaching nurses and midwives do not have the resources or infrastructure they need. Sometimes, countries simply do not train and graduate enough nurses and midwives, so there are shortages. This relates to the second challenge, which is jobs or employment of nurses and midwives. In some countries, although nurses and midwives graduate, there are not enough jobs for them. The shortages of nurses and midwives are mostly in low and middle income countries. Many times, these shortages are in rural or underserved areas. This can lead to unfairness in where nurses and midwives are located. The third challenge concerns leadership. Most nurses and midwives are women, and they are underrepresented in governmental leadership roles like planning the delivery of health services and developing or reforming health policy. About 70% of countries reported a government chief nursing office. About 50% of countries reported this for senior midwifery leader in the government. One reason for this is that countries are not investing in leadership programs. About half of the world's countries have programs to develop leadership skills in nursing. The fourth challenge relates to service delivery. In some countries, nurses and midwives might learn excellent skills, but the regulations about what they can do in health facilities are not up to date. So they do not fully use their skill sets. Nurses and midwives also need safe, supportive work environments to deliver effective health services to their full potential. Evidence in the reports on nursing and midwifery had a major impact at the 74th World Health Assembly in 2021. The COVID-19 pandemic had unquestionably highlighted the immense value of health workers. The stage was set for the World Health Assembly to issue a resolution to adopt the Global Strategic Directions for Nursing and Midwifery or SDNM 2021-2025. Nursing and midwifery leaders now have greater backing to advance the policy priorities in the strategic directions tailored to their country's needs. So, what are the priorities for nursing and midwifery in the SDNM 2021-2025? There are 12 policies for countries to take forward. All partners and stakeholders can contribute to putting these into operation and maximizing the contributions of nurses and midwives. For education, there are 4 policy priorities. 1. Align the levels of education programs to the optimal role of nurses and midwives in health facilities. 2. Use competency-based curricula and accreditation to ensure the quality of education is high. 3. Invest in development of the teaching faculty. 4. Increase the number of nursing and midwifery graduates. For jobs, there are 4 policy priorities. 1. Use health labor market analysis to understand how many graduates are needed and can be employed. 2. Create jobs when it is indicated. 3. Recruit and retain nurses and midwives where they are needed most. 4. Advance the WHO Global Code of Practice on the international recruitment of health personnel. For leadership, there are two policy priorities. 1. Establish or strengthen senior government leadership roles for nurses and midwives. 2. Support leadership development programs. For service delivery, there are two policy priorities. 1. Update and strengthen professional regulations. 2. Ensure decent work and enabling environments. To conclude, the Global Strategic Directions for Nursing and Midwifery presents concrete approaches for maximizing the roles of nurses and midwives to help achieve universal health coverage and meet SDGs. The SDNM 2021-2025 is clear, inclusive and empowering. It is endorsed by all member states. Now comes the serious task to implement it. WHO asks you to find out more about your country's specific challenges and which policy recommendations are the most resonant to meet your country's needs. WHO, working alongside other partners, will support action in a range of different ways. To find out more, visit our website. The SDNM is available in 7 languages. You can write to us at workforce2030@who.int. The SDNM 2021-2025 is clear, inclusive and empowering. It is endorsed by all member states. Now comes the serious task to implement it. WHO asks you to find out more about your country's specific challenges and which policy recommendations are the most resonant to meet your country's needs. WHO, working alongside other partners, will support action in a range of different ways.